Anulom Vilom, mental. Anulom Vilom is also called as alternate nostril breathing because we are alternatively breathing from the nostrils. Okay. In this, what we do is we will not be using our thumb and index finger like we normally do in alternate nostril breathing. We shall try to do it mentally. So we will inhale from, let's say, the left nostril, exhale from the right, then inhale from the right, exhale from the left, inhale from the left, and continue. Now, you cannot do this perfectly well, but you can make it so that the air is going from your left nostril, from the outer walls, from the inside, but outside. Okay, and when you exhale, it's coming from like kind of curved like that. Okay, so let's try to do this. There's no way you're going to tell I'm doing it, but let's just do it a few times. And when you exhale, slowly release. So, it's one might ask, how do I do this? So it's just like this. Some people, you can focus on the muscle in your ear and you can lift the ear. You can focus on the muscle of your eye and lift one eyebrow, right? Same way you can focus on the muscles of your nose and basically inhale from that nostril. Focus on the muscles of your right nostril and exhale from there. Focus on the muscles of the right nostril and inhale from there. And with practice, you'll be able to do Anulom Vilom mentally. And Anulom Vilom is a very beneficial breathing exercise because it helps to focus and balance our mind. When the mind is well balanced, it relaxes our body, and the body heals when it is relaxed. Marjarasana, very gentle flow. This is the cow to cat flow. Get into Marjarasana. Hands are directly underneath the shoulders. Fingers are wide apart to take away pressure from the wrists. Knees are slightly apart. Inhale, bend your spine down and look forward. And make it so that the base of your head is touching the neck. If you have cervical spinal injuries, just look straight. Okay, as you exhale, tuck your chin in towards the chest, arch your back up high and tuck your tailbone in. Let's repeat this 5 to 10 times. Inhale, looking forward, stick the tailbone and buttocks up. Exhale, and once again, tuck your chin and tailbone in. Back forms a nice arch. Continue. Be aware of your breathing and the stretch in your spine and the back muscles. This flow stimulates our spine. Breathe in, breathe out. And now slowly release and relax in tabletop position. Or you may slide your body into Balasana or child pose and completely relax. If you'd like, you may keep your knees wide apart. So raise your body, place your knees wide apart, and then go into Balasana. This will further give you a better stretch in the back muscles. Setu Bandha Asana. Setu means bridge in Sanskrit. Bandha means to hold or tighten. One should avoid this posture in case of severe neck or back pain. Begin by lying flat on the mat. Bend both the knees. Raise the hip area and place your elbows on the floor and hands underneath the waist. Now, while keeping the hips raised, try to straighten the legs. Rest the shoulders and the head on the ground. Remain in this position for 10 to 20 breaths. This posture strengthens our spine, leg muscles. It also stretches the abdominal organs. Breathe in, breathe out. Observe as you inhale, the lungs fill up, belly rises, rib cage expands slightly. As you exhale, the lungs empty, belly goes in, and the rib cage contracts back. This posture also increases the blood circulation in the upper body.
We are energizing our thyroid gland in this posture. Now to release, gently bring the hips back on the floor and the legs. Slowly stretch your arms. Let go of all your weight onto the floor and completely relax. Setu. Setu means bridge in Sanskrit. One should avoid this posture in case of neck injury and recent knee injury. Begin by lying flat on the mat. Bend the knees, placing your feet flat on the floor and position them a few inches apart. The feet should be directly underneath the knees and your knees should not be jutting out. The lower legs should be perpendicular to the floor. So pressing your feet and arms into the mat, raise your hips as you inhale. Interlace your fingers and stretch out your arms. Maneuver your shoulders and come up even higher if you can. Let's stay in this position for 10 to 20 ujjayis or ocean breaths. Now let me talk about a little bit of the flaw that can happen with the knees. So if your feet are very close to the hips, so if you can, Alexa, walk your feet towards your hips and then lift your hips off the ground, you notice how the knees are jutting out. We don't want that happening. So you want to come back down. Make sure your feet are directly underneath the knees. The feet are slightly apart. Okay, and the inner thighs are parallel, inner feet are parallel. Lift the hips off the ground, interlace the fingers, stretch your arms out, and maintain this position. Enjoy the stretch in the back muscles and leg muscles. This posture increases the blood circulation in your upper body, energizes the thyroid, and opens up the chest, giving you lungs more room to expand and thereby facilitate breathing. This is a wonderful pose to observe your diaphragmatic breathing. Observe as you inhale, your belly rises. As you exhale, the belly comes back down. This posture gives instant relief for people that are experiencing lower back pain or sciatica pain. To release, come out of the posture. Bring the hips on the ground, stretch your legs out, release your arms, and completely relax. Bhujangasana. Bhujanga means snake or serpent in Sanskrit. This posture is also known as the Cobra pose. We should not perform this pose with back, spinal or wrist injury. If you suffer from either of these, you may do baby cobra instead. To begin, lay on your belly on the mat. Keep your legs together so the thighs and lower legs touch. Place your hands on the mat, one on top of the other, close to your chest. On your next inhalation, slowly straighten your arms to bring your upper body off the mat. Keep your shoulders down, expanding the chest and ribcage with each breath. Raise your head and lean slightly backwards. Try to touch the base of your head to your neck and feel the stretch in your neck muscles. If you have neck or cervical spinal injury, simply look straight. As you raise your body, try to keep your hips on the floor. Make sure your legs and buttocks are relaxed. Enjoy the arch you have created in your spine. Remain here for 10 to 20 breaths. Bhujangasana strengthens the neck, spine, the arms, as well as stretches the chest and shoulders. In this posture, we are stimulating and energizing our pineal, pituitary, thyroid, pancreas glands, and the liver. Make sure your hips, legs, buttocks, shoulders, and face are all relaxed. To exit the posture, slowly bend the arms to return your upper body to the mat. Stretch your arms out on the mat, rest your face on one side and relax. Salabhasana. Salabh means locust or grasshopper in Sanskrit. Let's start by lying on the mat with the chin on the mat. Make gentle fists of your hands.
Take the thumb in and roll the fingers on top. Now place your fists underneath the groin region for support. Make sure your fists do not touch each other. Stretch both the legs and raise them as high as you can, or around 45 degrees. Maintain this for 10 to 20 breaths. Be aware of the stretch in your lower back and the leg muscles. Chin stays on the mat throughout the posture. Make sure your upper body is completely relaxed. Be aware of your breathing. Inhale and exhale. If you prefer, you may do Ujjayi's, ocean breath. Inhale, making the ocean wave sound. Exhale, making the ocean wave sound. As you exhale, slowly release the legs, hands. Turn your head to the other side and completely relax. Supt Vajrasana. Supt means easy in Sanskrit, while Vajra means thunderbolt. Avoid this posture if you have neck, spinal, or knee injuries. This is an advanced yoga posture, so please perform it with a lot of care. Let's begin in Vajrasana with your hips resting on your heels. Place your hands on the floor near the feet with the fingers pointing towards the toes. Now slowly as you exhale, lean back, bringing your elbows on the floor. Now release your elbows from the floor and bring the top of the head to rest on the floor. Let your palms rest on the floor facing down. Back forms a nice arch. Stay in this position for 10 to 20 breaths or as per your capacity. Be aware of your breathing and the wonderful stretch in the lower back, shoulders, neck, and leg muscles. Observe how the chest has expanded. This posture stimulates the thyroid, thymus, pancreas, kidneys, spleen, gonads, pelvis, and the liver. Observe your breathing. Your arms are completely relaxed. As you inhale, the lungs fill up with air, the belly rises, the ribcage expands slightly. As you exhale, the lungs empty, belly goes in, and the ribcage contracts back. Breathe in, breathe out. To release, slowly turn your body to one side. Stretch your legs out. Rest your body on the side for a couple of breaths. And then slowly come into a sitting posture. Stretch your legs out. Keep them slightly apart. And rotate and flex your ankle joints. Breathe in, breathe out. And then slowly release and relax in Dandasana. Malasana, Garland pose walk. Avoid Malasana or Garland pose if you have had knee surgery or are experiencing severe knee pain. Sit in a squatting position with your feet wide apart. Try to bring your heels on the floor. If it is difficult, just keep them raised. Make a namaste with your hands and now walk. Do this for about a minute or as per your capacity. In this posture, we are compressing and energizing our digestive organs, strengthening the leg muscles, and strengthening our knee joints. Slowly walk back to your mat. Come back to the starting position. Release your arms, legs, and come into seated positions. If you like, you can even stretch your legs out. And sit in Dandasana and relax. Halasana. Hala means plow in Sanskrit. This is the plow pose. Please avoid this posture if you have high blood pressure, glaucoma, or are menstruating. Let's begin by first stretching both the legs,
Gently raise the legs through 45 degrees, 90, and then extend the feet beyond the head until the legs are parallel to the floor. Continue to lower the feet until the toes touch the floor behind the head. Let's extend our arms in front of the body. Interlace your fingers and stretch the arms out. Another variation would be to interlace the fingers and place them near the crown of the head. Breathe in, breathe out. Maintain this for about 30 breaths or within your capacity. This posture increases blood circulation in the upper body, stretches the ligaments of the spinal column, energizes the thyroid and parathyroid glands, massages, tones, and stimulates all internal organs, especially the intestines, pancreas, spleen, and the liver. Improves function of the gonad and adrenal glands, adds glow to the face, and clears out facial acne and pimples. To release, exhale and gently bring the hips on the floor. Bring your arms back forward. Release the arms, the legs. Let go of all your weight onto the floor and completely relax. Let's do a couple of complementary postures. The first one is half fish. Let's support the lower back. Place your hands underneath the sacrum region. Using your elbows, bring the top of the head onto the floor and lift the shoulders off the ground. Here your neck is getting uncurled. This posture energizes the thyroid and also opens up your chest, making breathing a lot more easier. Maintain this for a few breaths. And then slowly release. Release your arms. And now let's do threading the needle. Bend one knee and place the foot on the outside of the knee. Take your arm from in between the legs. Interlace your fingers. Place the hand outside the knee. Squeeze the knees close to the chest. Enjoy the stretch in the thigh muscles. Sometimes when you do Sarvangasana, there's an arch in the back that's created, which feels very uncomfortable. This posture flattens that arch in the middle back. Breathe in, breathe out. And now slowly release, and let's go to the other side. Take the foot, place it outside the knee. Take the arm in between the legs. Bring the knees close to the chest. Breathe in, breathe out. Be aware of the stretch in the back muscles. And now to release, slowly release your arms, legs. Stretch your legs out, bring your arms by the side, collapse your body onto the floor, and completely relax. Shavasana. Let's begin by lying on the floor. Feet are 10 to 18 inches apart, palms facing the sky, fingers gently curled. Find a comfortable position for your head. Let's begin this mental relaxation, starting with the legs. Relax the feet, the lower legs, knee joints, thighs. Relax your hip joints, pelvis, abdominal muscles, chest muscles. Relax the shoulders and relax each and every vertebrae of yours. Relax the buttocks. Let's bring our awareness to the arms and send a wave of relaxation through all the muscles in both your arms. Relax your neck muscles, facial muscles, your eyes, eyelids, eyebrows. Bring your awareness to the head and relax the entire skull region. And observe your breathing, the smooth and steady breathing. If there is any part in your body that needs that extra relaxation, you may relax it now. Otherwise, stay focused on your breathing. To release, slowly wriggle your fingers and your toes. Gently turn on to your left side or your right side. Place your hand underneath the head, making a pillow out of it, and slowly come into a sitting position. Let's rub our palms, make them nice and warm. Place them on the eyes. Let the warmth flow from the palms to the eyes. Release the hands. Place them on the knees. Open your eyes.